guests. We have Dr. Haresh Mehta. He's a consultant interventional cardiologist from the Raheja Hospital with us. Thanks, Dr. Mehta, for being with us. Very, very sad that we're interviewing you on a day when, KK died of a heart attack. He was just 53 years old. I don't know if you could hear my conversation with Ehsan Noorani just a few moments ago. He was telling us he was telling us that he was actually a teetotaler. He was a non-smoker and he was fit as a fiddle. What explains such a severe heart attack at such a young age?
Yeah, good you brought this up. First, my condolences to the family, and he was one of my favorite singers. I think the commonest cause we are facing right now in our country is stress. Stress is building every day, the stress of work, the stress of earning money, and people are sleeping less, stress of performance, stress of being at the high level consistently, not wanting to slip down. So I think we have to realign ourselves and find what is good and find a balance between what you want to be and what is good for your health.
And it's very interesting that you actually talk about stress and how it can, it can so severely affect your health. Stress is not just something which has psychological manifestations, but obviously has very clear physical manifestations as well. How can one deal with it? I mean, it is a byproduct of a lot of us, living our lives on a daily basis. Stress is something that, you just sometimes take in your stride. Sometimes it gets the better of you. How better can you combat this?
Yeah. So one thing is that you have to rationalize your expectations, because that's the biggest problem we all face. Our expectations far exceed what we think we can do physically. That's one thing. And second is you have to find time for yourself. We never find time for ourselves. So you should learn to probably meditate, spend some time alone, spend some time exercising, spending time with family. So all these things have to be incorporated and to create a balanced lifestyle. We just keep working 24 hours, 7 days a week, 365 days a year. And we forget that our body cannot take all this simultaneously. We need to unwind, we need to take a break, we need to take a vacation. And probably meditation every day would help calming down nerves and get you more into...
Dr. Mehta, as a cardiologist, I also want to ask you, when somebody does experience discomfort, and supposing, you're not somebody who has a history of heart disease, for instance, so you're not familiar with what it's like, or your doctor hasn't apprised you of symptoms of a heart attack or what you should be watchful of. A lot of times, and even in this case, I mean, there's so many questions now being asked on, why there wasn't adequate medical care provided. Did emergency help, it wasn't there, not present at the concert venue. But a lot of questions really on the fact that, you could see KK sweating profusely, complaining about the heat, the lack of air conditioning, etc. What are some of the symptoms that a common person, say with no previous history of heart disease, watch out for and take seriously?
Yeah, so the commonest symptoms of a heart attack or an impending heart attack is that you get a compressive feeling in the chest, which radiates to the left arm or can radiate to the jaw. That is the commonest thing. But many of times you can't have that. Some of them just have excessive burping, acidity. As you said, he was excessively sweating. That's also one sign. And sometimes you just feel breathless or uneasy. So any symptom which can't be explained and makes you feel uneasy, you should seek attention immediately. You shouldn't pass it off as, it's just I'm probably tired and I'm sweating and something like that. So the second thing which is very important, which you spoke, which I think is very important, is that all the malls, concerts, public places, movie theaters should have a defibrillator. That's a machine which gives shock to the patient. Probably if that was there, we could have saved this one more life.
Right. What is this machine, and is it easy for anybody to sort of operate it?
It's very easy. In fact, in developed countries, it's a rule. They teach them in school, in colleges, how to do cardiopulmonary resuscitation. If you see someone lying dead on the floor, and it's a simple thing. It's just like you see in Hindi movies. You just have to attach 2 paddles on the chest and give a shock. And that has saved so many lives. And it's been done now in Bombay. And we are educating people, insisting that they put it in the societies where they live. And it's not a very expensive thing.
Right. Well, Dr. Mehta, I think this education and this awareness and, wake up calls, as tragic as this one has been, of the fact that we need to have better contingency plans, emergency services in place, I think is a much needed one. And I think you've really shed some important light on, symptoms that you need to watch out for, whether or not you have history of heart disease. There are certain symptoms and you should take them seriously and get medical help immediately. Hopefully it's nothing, but God forbid if it is something serious, at least you would have sought the help in time. Thanks very much, Dr. Mehta, for joining us.
Thank you very much.